resist me as I'm pushing down. Resist, 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 and then push. Squeeze your backside, squeeze your backside. You okay?
Yeah.
Do one more, pushing down. Now push nice and strong. Force me up. Good, keep going, keep going, keep going. Good. And take a breather.
Mittlerweile ist sein Gehgipsüberling noch mit einer Krücke und ich muss mich immer noch dementsprechend verhalten. Also muss viel zu Hause sein. Musste einige Dinge absagen diese Woche und letzte Woche, weil es halt nicht geht. Dafür bin ich froh, wenn das Sprunggelenk jetzt dann wieder fit ist in einigen Wochen, dass ich eigentlich wieder grundsätzlich fit werden kann und wieder ein bisschen Tennis spielen kann oder sonst mich sportlich betätigen, weil das ist natürlich mein Lebenselixier. Wenn ich keinen Sport machen kann, dann geht es mir sehr schlecht. Dass, wenn das jetzt wieder funktioniert, dass ich dann wieder sozusagen kraftvoll zubeißen kann.
What's happened here is Boris has had what we call a lateral ligament reconstruction of his ankle. There are a number of ligaments around the ankle that have got stretched. So Dr. Becker has gone in and tightened everything up in here. So you can see there's quite a bit of swelling around the area. So in the first few weeks what we're going to try and do is just reduce the swelling with some manual techniques, pushing the lymph and the blood back up towards the heart. In addition, we're going to get Boris doing some flexing and extending of his foot, just pushing away and pulling up towards him, and that's going to help us develop his walking, because he needs this movement when he's walking, and one of the primary objectives at the moment is to get him back on his feet. This is quite a nice way to drain the fluid from the ankle, because gravity helps you. So we're just using some pressure to push the fluid back towards the heart and to reduce the swelling. Well, I think it's a nice technique. Boris doesn't like it much because it hurts, but if I compress around his calf muscle and then ask him to point your toe towards the ceiling and then pull your toe down towards you, as he pulls the toe down, I can get a good stretch on his calf muscle. So we're going to show you an exercise that we do. If you bring your hands across here, we're challenging the ankle joint, but without moving it too much. It's just having a stabilization component to this exercise. Boris is going to keep the knees over his toes, and just in this position, because he's lying on the ball, there's a little bit of effort required to keep his ankles stable, because the ball's going to move a little bit. So this is a great way of developing his hip power, which treats that left hip, but also strengthening the right ankle as a unit, as a chain. So, Boris, if you drop your hips down towards the floor and then pushing up, and that's the same kind of power that he'd get through his serve. Good, keep it going, a little bit slower. You feel okay on your ankle?
Yeah.
He's not allowed to take his cast off when he goes out of the house, so if anyone sees him in the street without a cast on in the next 2 weeks, tell us.